The Victoria Respiratory Hospital is bursting at its seams, and with the high number of COVID-19 cases expected to rise even further, the president of the St. Lucia Medical and Dental Association, Dr. Merle Clarke, warns that something has to give.
The situation at the respiratory hospital is not sustainable. We are simply seeing too many patients coming in. There are too many patients requiring intensive care and high dependency care. There are too many patients requiring dialysis and other invasive services and procedures. Doctors, nurses, hospital personnel are tired and frustrated. There is fatigue on all fronts. This is not sustainable. We cannot continue to see this number of deaths. The mental health impact of all of this on our healthcare workers, on the families who cannot see their relatives, on just about everybody is too much.
The dire circumstances at the Victoria Respiratory Hospital are beginning to take a toll on the medical and administrative staff. The Slmda's president appeals to the members of the public, reminding them that their failure to heed the advice is hurting those who are expected to provide care for them when they fall ill.
Solutions, do your part, get vaccinated. We recently heard in Grenada that an ethics committee to determine essentially who lives and who dies is going to be established. The reality of that is that with the surge in COVID-19, this may very well become inevitable here. To a certain extent, this is done on a daily basis in hospitals, particularly in hospitals with limited resources. One has to determine, is this patient an ICU candidate? And that's under normal circumstances. Is this patient the best candidate, for example, for dialysis when you have limited resources? We had improved in that regard for the most part. But with the surge in COVID-19, we're going back to those situations. And that is simply not acceptable.
With more than 2,300 active cases as of Tuesday, 15th September, it means that only about 1 in every 15 COVID-19 patients is being treated at hospital. This means that the members of the medical staff have the unenviable task of deciding who gets treatment and who doesn't, and crucially, what type of treatment each patient receives, given that the demand for care far outstrips the capacity to provide care.
We need to remember that it's not just a question of COVID-19, that if hospitals are overwhelmed with COVID-19 patients, then other patients requiring care and healthcare services are also impacted. You see stories from around the world of patients who might have had a heart attack or stroke or any other pathology that we see every day who had to be turned away because there were no beds available. Those are the realities that we're facing. So the idea of an ethics committee and everybody being outraged is really just an official something on paper. Those are the realities that we are going to face, and in a sense that we are facing. If we do not do our part and stem this steady rise in cases of COVID-19, where we've seen patients who are sicker than they have ever been, we are going to be overwhelmed. Some of our physicians and nurses and other healthcare providers are going to get tired and are also going to get sick. So do your part, get vaccinated, adhere to the protocols. It really is the only way out of this.
The fourth wave of COVID-19 in St. Lucia is beginning to bite, probably where it most matters, among medical staff at the Victoria Respiratory Hospital. This is what the medical experts had been warning about, the fear that the failure to adhere to the prescribed protocols and the low vaccination uptake would lead to a dire situation in which the number of cases is beyond what the medical service can manage, thereby negatively impacting medical staff and the quality of service that they deliver. Stanley Lucia for the HTS News Force.